That's
the
pretty
way I
cool.
did.
Yeah. How does that play out now in your current work? That background, how do you bring that to the current work, especially working uh, with women in menopause?
Well, the whole time that I've worked in urology, urology is actually a surgical field, and I gave up surgery some years
Mm.
ago. But I would always say that I was a primary care doctor in a surgeon's body because I really, or maybe the opposite, I guess, a surgeon in a primary care doctor's body or mind, because I've always said I like the relationships with people, and I like, my connection with my patients. I like spending more time. That was always something throughout my career that could sometimes be, what some thought of as a problem is I took too long with my patients. I couldn't pack in as many patients in a day, because I wanted to spend the time. I wanted to get to know them, and their families and their communities and how that whole big picture affected their medical care. And so I would often joke kind of that I practice uro-psych because I do talk about mental health frequently with my patients because that's a part of their overall care. And I think that having that initial interest and background is really what helps me um, connect that way with patients and know that they're not just a body part and they're not just one body part, but it's the whole picture. It's the whole um, patient, their family, their social interactions, their community. That's all part of who they are and helping care for them. And it's not the same for everybody.
And in menopause care, and I would imagine the sexual dysfunction that associates with older patients. Obviously, those are very vulnerable positions. How do you set them at ease when you first meet them?
I think that's something that I really enjoy. I really like that part of it. I have a lot of patients, men and women, but first, as far as the women who grew up at a time that it was not appropriate to discuss those things. It was not something you talk about. I have patients that I see that will tell me their backgrounds and that they never knew things about their own bodies because it wasn't something to talk about. And so, I try to always just make people feel comfortable and talk very matter of factly, but understanding where they come from and letting them know it's okay to talk about it. And while I understand and it's okay for them to be uncomfortable, it's what I do all day. It's what I do all the time. I'm not uncomfortable. There's nothing they can tell me or say to me that's going to shock me or surprise me or make me question them, and that it's all part of their health, our sexual health, our mental health, our physical health. Those are all part of our health. And so I find a lot of women in particular, when I talk about these vulnerable things and I acknowledge that I know it's vulnerable, but I'm here and I'm happy to talk about it. They feel more comfortable. And I've had many men that will say to me at the end of a visit, wow, thank you that you really made this comfortable when I did not expect this to be a comfortable conversation. Or that when they made the appointment, they didn't realize I was a woman and that they were surprised at the end of the appointment how comfortable they felt talking to me because it's just very natural and it's not something, and I think there's a difference between saying there's nothing to be embarrassed about and acknowledging I know it can be embarrassing because I think sometimes when we say to someone, there's nothing to be embarrassed about, this is normal, it's not acknowledging how they feel. And it is embarrassing for some people and it is hard for some people. And I can acknowledge that, but also say that, but I'm okay with it and we'll talk about it however you want. And I understand that, but it's not embarrassing for me and I'm comfortable. So hopefully I can make you comfortable.
And in the past, especially when you first started working with menopausal patients, were there any hard lessons you learned early on that kind of helped you now?
I think that um not necessarily specific to menopause,
Okay.
but in general, that it wasn't necessarily a hard lesson for myself, but as a member of the healthcare community, the healthcare trauma that some people have experienced and the lack of empathy and the lack of understanding in healthcare. I'm sure I was not as good with that stuff when I first started, but also just in general in healthcare, we're not taught that.
Right.
Um, and I think that learning how many patients have suffered through bad interactions with other people in healthcare that then limit their ability to really open up to their doctor and be honest, which then, I always say to a patient that there are very few things you need to see the utmost top specialist in any field. There are a few things like that, but most things, you need a doctor that you're comfortable with, that you can talk to and be honest with. Because just because I give you a suggestion, if it's not right for you, it's not right for you. Just because it's right for someone else doesn't make it right for you. And if you can't be honest with me about your comfort level in a certain option or your history or any of those things, then it's not right for you. And when we don't recognize people's previous interactions with healthcare and other healthcare workers, that we don't acknowledge that they may have had trauma or uncomfortable situations in the past, that the options I'm providing aren't the right ones, and I have to be open to exploring what other options are better for that individual, even if it's not what I would generally recommend to somebody else.
Mm. Wow.